right, so like I said, I cannot believe this is the end of Good Dog's fourth annual health symposium. The month has flown by, and it has been such an incredible event from start to finish. Just hearing our amazing speakers teaching our community about all of the ins and outs of breeding, having healthier outcomes, raising healthier puppies. And it's been so amazing to hear feedback from our community about what they've learned, what they plan on implementing in their breeding programs, because that's exactly why we host this event every year. It's how we're able to give back to all of you by having these free virtual opportunities so that anyone can join, no matter where you live, to learn from the best and really raise the bar on all of our breeding programs and have a healthier future for all of our dogs. So it's been such an amazing year, and I want to thank our amazing audience for making all of that possible. You've welcomed all of our speakers. You've asked such thoughtful questions. So thank you to everyone who has viewed these presentations, whether you've joined us for all four of the sessions now, or you're just tuning in for this one. We are so grateful that you're here and that you show up for this community. And we're so excited to keep giving back to all of you through events like this. So to conclude our 2024 Health Symposium, we have Dr. Carla Barstow joining us again to continue her presentation from earlier this month with Breeding Healthy Dogs, Part 2. So if you missed Part 1, we can drop a link in the chat to that recording so you can watch it afterwards. And it was an amazing discussion. We got such great feedback from our community. I could tell you were all eager for her to rejoin us. So we're so happy that she's back. In Part 2 of this discussion, Dr. Barstow is going to be sharing tips and tricks to having the best possible breeding outcomes, what diagnostic tests and supplements are needed, and which ones can be skipped, and also discussing the myths and facts surrounding breeding. So a really nice continuation of the foundation we laid in Part 1. Before we get into the whole presentation, I just want to extend a big thank you, as always, to our friends at Purina Pro Plan for bringing this event to life with us. We're so grateful to continue working with them to bring these opportunities to our community. And as always, during the Q&A segment of this presentation, we're going to prioritize those previously asked questions, but I'm anticipating a ton will come live through the chat, so please use that as well for any questions that pop into your head as Dr. Barstow presents, and we will try our best to get to them at the end. And as I've shared throughout the entire symposium, we are going to be posting a quiz after this last session so you can test your knowledge on what you learned. And this is going to be the last quiz that we share. And as a reminder, if you complete all four of the quizzes that we've shared throughout the month by the end of the symposium, you're going to be automatically eligible to win prizes from our partners like Purina, Snuggle Puppy, Revival, and more. And we're going to announce those winners on Monday, October 28th. So if you have no idea what I'm talking about, don't worry. We have all of our session recordings and those corresponding quizzes available in our private group, and you have until the end, well, not really the end of the week, I guess, Monday morning to do that, and then we'll be picking the winners on Monday afternoon. So hopefully you have plenty of time to make sure you completed all of those quizzes. And as I mentioned, this last quiz for this session will be going up shortly after this, so keep an eye out for that. And I want to just share a little more about Good Dog before I talk about our amazing speaker. For anyone who's unfamiliar with us, Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for responsible dog breeders, educating the public, and promoting canine health and responsible dog ownership. We're a secure online community created just for responsible breeders to connect you with serious, quality Good Dog applicants from all across the country to find forever homes for your puppies. And from this chat, I can see we have a lot of people with puppies on the ground right now, which is really exciting. We help good breeders level up their breeding programs with the power of technology by providing them with tools like our secure payment system to protect them from scams, our best-in-class software to post available litters and start connecting with Good Dog applicants, as well as a number of free educational resources just like this, health-related discounts, and more, all intended to help your breeding programs thrive and give you much-needed time back to be with your dogs. So if you're not yet a member of our community, we'd love to have you join us by applying at gooddog.com/join, which we just dropped in the chat, so everyone has that. We would love to have anyone new join us, so please check out that link, reach out to us at breederteam@gooddog.com with any questions. Lastly, I just want to share a little bit about Dr. Barstow before I stop talking. Dr. Barstow is a diplomat of the American College of Theriogenology. She's an active member of the Society for Theriogenology, Dr. Barstow practices in small animal medicine in Lakeland, Florida, and is the only reproductive specialist serving the greater Tampa, Florida area. In her practice, Dr. Barstow works with dog breeders to breed healthier dogs, hence why she's here today. And she is a longtime breeder of Samoyeds and participates in dog shows. So if you have any Samoyed breeders here, please make yourselves known in the chat because we would love to hear. And with that, I'm going to pass it over to Dr. Barstow to get the presentation started.
Perfect. Thank you so much, Nicole. Thank you all so much for joining us again today. Hope everybody is doing well. All right, so just kind of a quick little recap about what we discussed from the last time. I know they said they're going to be dropping the link in case you missed it, but some of the big topics that we talked about were some of the health testing and making sure that we're doing the clearances and making sure that we're breeding the healthiest dogs we can with our genetic tests and OFA hips and elbows and cardiac and all of those things. When we were talking about our vaccinations to make sure at least that we had our rabies taken care of. So we had that covered. Making sure that we're breeding animals that are a little bit older and skeletally mature, so closer to that 2 years of age, making sure that they're on a good quality nutrition and that they're at a good body condition score and they're not overweight or underweight, making sure that they stay on their heartworm and flea medication. So heartworm medications, we have safe ones that are safe. Woo, okay. We have medications that are safe while they are pregnant and nursing. And then any supplements that you buy, you want to make sure it has that nice big bright yellow NASC label on it to make sure that it is actually gone through some third-party purity testing and all of those things. So all of that is covered in that last episode that we did. Today, we're going to talk a little bit about shifting some of our gears. When are we going to be doing the breeding? How are we going to be doing the breeding? Different ways for pregnancy confirmation, talking a little bit about some of our whelping concerns that we might have, what are our next steps in the breeding program? And then we're going to touch on some male specific topics because I feel we've kind of really focused in on the bitch. So I don't want to forget about our boys because they're kind of important for our breeding program as well. All right, so starting first off with our breeding. So quick and dirty on the progesterone. Dr. Hesser did a really nice talk several weeks ago, going a little bit more depth in this, but just quick recap for those that might have missed that talk. When we're talking about our progesterone timing, our baseline progesterone is basically anything less than 2 nanograms. The LH surge, which you'll hear us kind of refer to, happens somewhere around a progesterone of 2 to 3. Ovulation occurs between 4 and 10. I know a lot of people think that ovulation happens at 5. It's a little bit of a range, somewhere between that 4 and 10 range. Now, these are all in nanograms per ml. So if you are from Canada, I think they use nanomoles, which these numbers would be a little bit different. And I apologize, I don't have that conversion off the top of my head. Once their progesterone goes over 10, ovulation is considered complete. And then we're ready to start looking into when we're going to be doing our breeding. So quick and dirty, our optimal breeding day is about 2 to 3 days after ovulation. And so I like to try to teach people simple things. Obviously, most girls don't read the book, which is why you get to come see me and I get to assist you with your breeding practices. But my quick and dirty rule that I like to teach people is the 2-2-2 rule. So at a progesterone of 2, usually when they're having their LH surge, they should ovulate 2 to 3 days later, and then we're going to breed them 2 to 3 days later. So that's kind of like our quick and dirty thing to always kind of keep in the back of your mind when we're kind of going through all of these, some of the logistics that are involved in this. All right, so just for those of you who are visual learners, I've got this little timeline here. So we see the bitch on Friday, she's at a 0.4. She comes back on Monday, she's at a 2.4. She's rising very nicely. Wednesday, she hits a 6.7, and then Thursday, she's a 12.8. So most likely we're going to say her LH surge happened on Monday at that 2.4, and then ovulation occurred at that 6.7 mark. So which is going to make her fertile window that Friday, Saturday, and Sunday. You know what? There's a hurricane coming. I'm from Florida. We live in this. And so I put that on there to say, always have a backup plan. Some of you guys right now are currently talking about the heat wave that you guys are having. I'm in Florida. Florida doesn't ever participate in the winter sport. So when people are looking to ship semen from out of state, figure out where the semen is coming from. Unfortunately, with the past hurricane that we just had, Tampa International Airport was actually grounded for several days, which means nothing's getting in or out, which means I can't have semen shipped into me. So always having a backup stud dog that's local is a great idea, even though he may not be your first choice, but sometimes things happen. You know, he had a litter a year ago, semen was great. Now all of a sudden we collected him, his semen's now bloody, you know, and that's not necessarily the thing you want to necessarily put into your bitch. And then the other thing is, unfortunately, we do have to know about our different carriers and stuff like that. Amazon's not delivering semen just yet. So we're limited on when we can get packages delivered. And then for FedEx, not complete hate against them, but every package that FedEx delivers has to go through Memphis. So if Memphis is in the middle of a snowstorm, it's a good possibility it's not going to get out of Memphis and then delivered to wherever you're going. We had a semen shipment that was being shipped to us from Miami that got stuck in Memphis. I thought that was quite crazy. I'm like, why did it ever leave the States? But stranger things have happened. So always have a backup plan when things are going. We will go back to our timeline a little bit further as we go through some of these things. So you know exactly what those dates and all of that mean. So next question then is, how are you planning on breeding? Are we doing a natural life cover? Are we doing a vaginal artificial insemination? Are we doing a transcervical insemination, or are we going to do a surgical insemination? So a couple different breeding options, but how do we know what breeding option to pick if we don't know what kind of semen we're using? So I'm going to start here first. So obviously with our semen, we've got fresh, cool shipped, and then frozen. When I'm wanting semen delivered for me to use for a breeding, I'm looking to have 150 to 200 million progressively motile sperm. That is an ideal breeding dose. So when I'm looking at frozen semen that was frozen, you know, 20 years ago, I may ask for more semen than what was originally said is needed for a breeding dose, because we know that these have changed over the years. And also it may not thaw as well as it previously had. Now, some breeds I know, like my little Chihuahuas and my little Yorkies, I may not get as much semen out of them, but we know that I'm not expecting them to give me as much semen, just kind of something to keep in mind. But for most normal sized dogs, this is kind of a good ballpark to be in. Now, when we're dealing with our fresh semen, this can live in the bitch 7 to 10 days. So that's kind of a big important factor that we need to remember, which is why we can see so many dogs running around. Fresh semen is great for our local dogs, so you can do a natural breeding with them. We can also do a vaginal artificial insemination or that transcervical insemination with that. Moving on to cool ship semen. This is also known as like chilled semen. Has a couple of different names, but this is freshly collected from the male. Extender is added, and then it is shipped to me for me to use, preferably within 24 to 48 hours. We've starting to see better things as we're coming and we're learning more, that semen lives so much better if we can use it within 24 hours, that we start to lose a lot of our motility after about that 48-hour mark. Now, can it still be swimming 4 to 5 days later? Absolutely. And I'm going to do a little sidebar here, one of my little fun soapboxes. I know that they do make 5 and 10 day extenders. And basically, they extended the semen with the 5 or the 10 day extender. They put it in the refrigerator, and then they put it on the microscope. Is it still swimming? Yes, it's still swimming. But what they didn't do with those 5 and 10 day extenders is they didn't put it in a bitch and try to get her pregnant after it's been sitting in the refrigerator for 5 days. I want to see that study before I'm going to believe that's ever going to live 5 days in a box. But if you're going to send me 2 shipments, so you want to do 2 breedings for your dog, and you're going to send 2 vials in one box to save on shipping costs, because I know shipping has gotten absolutely ridiculous recently. I'm going to put everything you send me in the bitch. I'm not going to hold back a dose, because it lives better in the bitch than in a box. She is well prepped to take care of the semen and to make it do what it needs to do and make it live longer, significantly better than any extender that we've ever come up with. So That's kind of my little soapbox sidebar on that one for you. So if you're going to ship semen, we're going to use it that following day. We can ship a Saturday for a Monday breeding. It's not really ideal anymore, just because we do know that we can start to really drop off some of our fertility, motility on that. Obviously, when we are cool shipping semen, we do have to have better quality semen so it can live and survive the journey to get here. We're going to make sure that we've got better timing for our progesterone end of it to make sure we're, not wasting your money. And then obviously we can breed them with a vaginal, a TCI, or a surgical. And obviously this is going to cost more just from the shipping aspect of it. So if we're looking at frozen semen, obviously this had to have been good to excellent quality before it's frozen, so it can actually do its job. Once it's thawed, I take it out of my tank and I thaw it to use it only alive in the bitch for 12 to 24 hours. So this is where our timing has to be perfect. And then we're very cautious on this. Once the semen is frozen and it's in the tank, it can live in the tank almost indefinitely. As long as the tanks are maintained the way they're supposed to be. But once it's thawed, we've got a very narrow window in which we're trying to hit. And then for frozen semen, it must be placed into the uterus. So this is going to be a TCI or a surgical. And obviously money for this is going to cost significantly more because your timing is going to be a lot higher with everything going on there. All right, so if we're doing the vaginal artificial insemination, so again, this is that fresh or cool ship semen. So you can either use the basic insemination pipettes that are here, hoist their hind end up into the air and let them sit there for about 10 to 15 minutes. Or Minitube makes these like nice little MOFA or Mavic catheters that you can use. And it's got that little bulb on the end of it to kind of help stimulate the tie for the bitch. Again, we want better quality semen when we're doing our vaginal artificial inseminations. There was recently a study that talked about the timing for holding them up in the air. And if you held them up for 10 minutes versus you only held them up for 1 minute after you put the semen in them. And there was no difference in pregnancy rates. So for that, when I'm doing artificial inseminations here in the clinic, I only ask them to be up in the air for 5 minutes now. I'm not quite brave enough to go to that 1 minute mark. But the study says that there's no difference between it. So food for thought for you guys. So you don't have to keep them up in the air for that 10 to 15 minutes. They hate it anyways. All right, so transcervical insemination. So for those of you that have never actually seen what the scope looks like, this is my scope here at the bottom. This is a traditional, regular, everyday pen, and that is the entire length of the scope. Not all of it has to go into the bitch, but depending on the size of the bitch, a good portion of it does go into her. The nice thing with the transcervical, the camera on the end of it allows me to visualize the cervix. I get to bypass the cervix, put the semen directly into the uterus, so I can have my frozen semen, I can have my poor quality semen. I'm going to put it right where it needs to go. These bitches usually stand so nicely for this because they're in standing heat when we're breeding them. So we don't really even need to worry about anesthesia, which is honestly the best thing that we can do for them. And then that is a picture of, so this is the cervix here. There's a catheter going right through that there. But on my next slide here, if I can get to my, oh, I guess I have to turn my laser pointer off maybe. I do. All right. So this is a little video here of actually going in. So this is the vaginal canal that we can see. We got that nice crenulated tissue we want. We're coming up to the cervix, and then we're going to pop that catheter right in. So this video is literally 16 seconds. That is all that it took me to get that catheter in and get this dog bred. Obviously I have done years and years of practice and years of experience, because for some, this can be the absolutely world's worst video game ever when we're dealing with this. Oh, next slide. There we go. All right. Now then, when we're dealing with our surgical inseminations, this is where are also going to be putting the semen directly into the uterus or bypassing that cervix. It does obviously require anesthesia. There are a lot of countries, Australia, UK, most of the European Union, where this is now illegal. Because the transcervical insemination exists, you cannot do surgical inseminations. And in my practice, I don't do surgical inseminations unless I've got frozen semen and I am unable to catheterize that cervix with my TCI scope. That is the only time I will ever convert to a surgical insemination. I know a lot of people are saying that, if you've got poor quality semen, a surgical insemination is, just as good, but surgery is not without risks. Anesthesia is not without risks. And I don't want to be putting your bitch under anesthesia for crappy semen. It's not worth the risk in my mind. I'd much rather do a TCI when I know it's going to put the semen into the exact same spot. So again, our diagram of our vaginal tract here. So down here, we've got our vulva and then the anal opening, just to kind of orientate you guys here. So this first little X is where semen would be deposited in a natural tie or a vaginal insemination. So when we're putting it here, then we tilt them forward to get it to run through that cervical opening there. Now, with a natural tie, the males are producing a large amount of prostatic fluid, which helps to push the sperm through the cervix. So they've got that little advantage, which is why we tilt them upward. When we're doing a surgical or a TCI, we're putting that semen directly into the uterus. There is no difference. The data out there says that there's no difference in pregnancy rates, or pregnancy rates might be slightly higher in a TCI. And honestly, 16 seconds for me to get a catheter in. The one I did earlier this morning, maybe 2 minutes. It was a bigger Shiloh Shepherd, so a slightly bigger dog. But I can't do surgery that fast. I mean, start to finish for a surgical, you're still looking 20 minutes from induction to recovery and all of that. And so this is so much faster, so much easier on them. Definitely highly recommend TCI is the way to go. So now then back to our timeline. When we're going to be breeding, if you're going to be doing natural breedings, honestly, you want to make sure that you get your ties done during your fertile window. So in this particular instance, Friday, Saturday, Sunday, absolutely. Those are the days we want to make sure that we're getting semen into these bitches. Now, if this is going to be some cool ship semen, again, because I can't get semen on a Sunday, we may do our shipments for a Friday and a Saturday breeding if you want to, or if you can only get one, we may push for a Saturday and hope FedEx is, or UPS is able to get the package to us. Sometimes I like to err on the side of caution, knowing that once the semen is in here, it can live. I'm going to try to see if I can push things, maybe go a little sooner so I'm not having to worry about shipments getting lost and things happening, because unfortunately that does happen way too often. If this is frozen semen, I'm going to be pushing towards the end of that timeline, because I want to wait until all of those eggs are mature. So dogs are very special, and the eggs that they ovulate are not ready to be fertilized, unlike other species. Cats, when they go through the breeding process, the semen is already there waiting on them. Horses, when they drop that egg, you need to have that semen in there within 6 hours to catch that egg. Dogs, not so much. They give us time, which gives us a lot of grace, which is why we can be so lucky getting the majority of them pregnant that we do. Now, however, in this scenario, these are not my favorite ones, because then I'm looking at having to either collect semen for a Saturday shipment for a Monday breeding, if it's not a local dog or if it's a shipped dog, or then I'm, hoping that, we're going to get that semen for a Monday for a Tuesday breeding and still be within our window. But then, of course, we're hoping that nothing goes wrong with our shipments. Now, this isn't to be said that they can't be bred outside their fertile window and still get pregnant. Absolutely, they can. But we know we're going to maximize our conception rates if we can stick within that fertile window as best as possible. Now, sometimes with frozen semen, we may push a little further out on that window, depending on how they rise and where they go. And that's going to be individually depending on the bitch. She runs this show completely. We're just along for the ride. All right, so kind of switching gears, kind of going a little bit more towards our pregnancy diagnosis. We did get a little bit of a question on false pregnancy last time, so I wanted to bring this back and kind of give you a little bit better idea as to why dogs go through that false pregnancy. And I did look up some of the data, and 87% of bitches will have a false pregnancy 2 or more times in their lifetime. This does not really impact their health for them to have a false pregnancy so much as if they go on to lactate and then end up with mastitis. That's a rarer case, but it's still a possibility. So this graph shows us Basically, the orange line is our progesterone. And so we get our ovulation mark. Please ignore the 5 there. This is somebody else's chart that I just borrowed. And then progesterone stays high throughout gestation, okay, regardless if they're pregnant or not. And that's the thing that we need to be concerned about is progesterone is what keeps them out of heat, keeps them from cycling, also what sets them up for pyometra in the future. But progesterone being high the entire time, which is also what sets them up for this false pregnancy. Now, the other hormone that wasn't on this thing that I did add is this lovely little thing called prolactin. So, when prolactin rises high enough and progesterone is low enough, this is where they're going to be able to lactate and start to lactate. Now, this is important in our, other species like our wolves, because we have our alpha female that's going to be the one that's breeding, and the other ones are going to be helping to cycle one with her. So, dormitory effect, all the girls cycle together in the house to help take care of all of these other puppies and to help raise them as their own without having to put too much of a demand on one bitch in particular. So, it is of evolutionary advantage. However, if you only have the one bitch, it's kind of a pain in the butt to have to deal with. The other thing is you can get a false pregnancy if you wait at this critical junction and your bitch gets spayed when progesterone is dropping and prolactin is rising. Even though she gets spayed, she will still lactate, and it's all hormonally driven. Doesn't mean that anything was left behind. It's just the nature of the beast and their brains doing weird things. We got to love our hormones. All right. So gestation length is 63 days plus or minus a day from ovulation. So if we don't know when they ovulated with our progesterone timing, then I don't really know when they're due. We can't use breeding dates because, as we said earlier, semen can live up to 10 days in the uterus, which means from a single breeding, a bitch can be pregnant anywhere from 58 to 72 days. That is a huge range to look at when we're talking about some of these dogs and when we're not really sure exactly when they're due. Some boys are great and they're always going to get them right when they're supposed to be bred. Some bitches will stand the entire time, and usually males, they'll breed anything that'll hold still for them. So all right, now then, how are we going to go ahead and we're going to diagnose them as being pregnant? So we can palpate them, so we can actually feel the babies in the uterus. This is best done around that 28 to 35 day mark. Now, this is good for our skinnier dogs, our smaller breed dogs. It's great in cats, but some of our bigger, larger breed dogs, Newfoundlands, Bulldogs, they're really kind of hard to be able to get in there and to feel everything appropriately. The relaxin assay, so this is a blood test. Some people have probably done themselves on their dogs. So this particular test checks for a hormone, similar like in humans, we go and we pee on a stick. Can't use that hormone in dogs because that H stands for human. We can do the blood test. However, at that 28 to 30 day mark, if it comes back negative, it's possible if she has a small litter or she's not pregnant. So those are kind of our two things. You have to have enough puppies in there for these tests to even come up positive. But this test also has a really long half-life. So if she got pregnant and lost the litter for some reason, it's still going to be positive. You can actually draw blood on a bitch who gave birth, 1 or 2 days later, and it's still going to come up positive because it has such a long half-life and it sticks around in their system for a while. So they exist. They're not greatly accurate, but sometimes in a pinch, they're kind of nice. My preference, obviously, is ultrasound. This can be done anytime 25 days after ultrasound, after ovulation, anytime up to parturition. What I love about ultrasound, it allows me to see, do I have viable fetuses? Can I go in there and I can see I've got a nice little baby here? I can look for that heartbeat. If this was a video, it's not, I apologize. So I know I've got puppies, or do I have an empty gestational resorption site here? So it was pregnant, but it's no longer pregnant. So when I see a bunch of these, I do get concerned. I do wonder about certain breeds having more prevalence of them, or if we see a bunch of them, why are they there? And we're going to monitor this pregnancy a little bit closer. Or do I have, a huge litter of a bunch of puppies? It kind of lets us start kind of planning for the future and where we need to go next with her. Radiographs, these are very important if you were free whelping. If you were planning a C-section for your bitch, a radiograph is not needed, because when we go in there to do surgery to take out all the puppies, we're going to be taking them all out. Doesn't matter how many are in there. Save your money. Put it towards the ultrasound instead. But it lets me know exactly how many puppies I've got. So I've got 1, 2, 3, 4, 5, 6 puppies here. This is great because it allows me to see, yes, I've got 6 puppies. Yeah, they look size-wise appropriate, shouldn't have any issues, giving birth and having these puppies on her own. However, it's really difficult sometimes to be able to look at their size on the x-ray and know for sure that they're going to get stuck unless we've got 1 or 2 puppies, then they're usually bigger. But at least it gives us an idea of where we're at with this. All right, some things on whelping. So these are just kind of some of the more of the problems that you might run into and kind of when you need to reach out. When you're going through the whelping process, I'm a huge fan of knowing where your local emergency clinics are, who is nice and favorable to breeders, who's not going to spay your bitch if you have to show up at 2 o'clock in the morning for an emergency C-section. Those are things you want to know before you get stuck. With everything. Our temperature drop that a lot of us use when we're taking our temperature that last week in pregnancy, you always want to compare morning to morning, never morning to evening, okay? Because we know our temperature is going to fluctuate throughout the day. And so you always want to compare the morning, so that Monday morning temperature to that Tuesday morning temperature. Maybe there's our temp drop. However, in some breeds, or if they have a slow drop in progesterone, you may not get that temperature drop. It just may not happen. So it's very possible to miss it. Or if we have a singleton puppy or a smaller litter size for a big breed, so if a lab only has 1 or 2 puppies, that temperature drop may not happen because they may not go into labor and get the appropriate signals that they're supposed to. Once they go into first stage labor, that panting, that restlessness, sometimes they may vomit. If this goes over 12 hours, this is where I might get a little bit concerned. Have you come in, just pop an ultrasound on the puppies, make sure everything still looks good, make sure things are still where they need to be, and then, kind of send you on your way, see how things are going. If you see that placental green, that beautiful placental green that we all know and love that stains everything, for more than 30 minutes before the first puppy. After the first puppy, it's really kind of hard to use this as a gauge, but if you've got it for more than 30 minutes before the first puppy, I'm really concerned about the health and the viability of that puppy because it's probably stressed and we may need to see it and see what's kind of going on in there. Once we get into that second stage labor, if we get those like weak and intermittent contractions more than 4 hours before the first puppy, or if we've had that second puppy, we've already had that 1 puppy and it's been more than 2 hours between puppies, or we've been having that hard continuous contractions bearing down, pushing for more than 30 minutes. Those are all of my call-if parameters. The reason I have them, I know they can go longer than that, but by the time you hit that 2-hour mark, if we haven't had a puppy yet, by the time you get the bitch loaded up, get her packed up into the car, you get to wherever you need to get, and by the time they get you seen and assessed, particularly at an emergency clinic that might be busy, you might be getting close to pushing that 4-hour mark. And so that's why I have my 2-hour mark there, because we know that we've got better puppy survivability if we can have puppies every hour. Yes, I know they can go longer, but the studies say that the more often we can have puppies, the better. Obviously, we're in that labor, we hit that hour mark, I get them up, I get them walking, I get them moving, just like those little pregnant ladies at the hospital walking up and down the hall. If it's the middle of the night and you're outside walking them, make sure you have a flashlight and a towel. Not uncommon for them to squat to pee, pass the puppy at the same time. And there's been many times that, they hit that 2-hour mark, they call us, they give us the heads up, they head on in, and then they're stopped on the interstate having a puppy, which is great, which is what we want. Sometimes those car rides are enough to get them to stimulate them to do things and to get things moving. And that's really what we want, is we want things to keep moving for them. And even if they get here, things look good, fine. You know what? I can put an ultrasound on them. I know everybody looks good. I'm not concerned. And then we can keep moving on with things. All right, so reasons that we can have a dystocia or a difficult birth. So uterine inertia basically just means the uterus is tired. You can have a primary uterine inertia. So for some reason, the labor just doesn't start. We don't see this one as commonly. This is usually in a normal large size litter, and for some reason, she's at like day 63 past her, or sorry, day 65 past her due date. Those are the ones that we get concerned about. We need to step in and help them out with. Or secondary, so it's due to uterine fatigue. She's got a really large litter. If she's going every 2 hours between puppies and she's tired and she's not having it. Obviously, fetal oversize is a problem that we can see as well. This picture here is a fetal anasarca, so a water puppy. Not that common, but they can definitely happen, which obviously that's not coming out the way nature intended. So that gets to come to me for me to surgically remove him. But when we're talking about dystocias, it's never the head that gets stuck. It's always the shoulders. The shoulders are the widest part. And that's the thing we get concerned about. And that's the tough part to look at an x-ray and see. I can measure the head, yes. I can measure the pelvis. I can see that those are going to fit, but the shoulders, I can't measure off an x-ray very easily. This one's actually quite nice because I can actually see where my shoulders are, but I just see the bony structures. I can't see how much of this is skin out to the sides to be able to say that, yes, this puppy could have passed. The head got there, and then it was like, I'm stupid. I'm stuck. I need help. All right. So when we're doing our C-section timing, or we're planning a C-section, timing is absolutely everything. Because if we take puppies more than 2 days early, their ability to survive is going to be significantly lower than a full-term dog. We can't use our breeding dates, as we mentioned previously. So this is where progesterone timing is very important. If we didn't do progesterone timing and you show up in my clinic and you're telling me your bitch is 63 days, I'm going to run a progesterone on her. And if her progesterone's not low enough, I'm not going to cut her, because I want you to have beautiful, healthy puppies and not those little hairless creatures that are there. Those are actual early, they are cats, they're not sphinxes, but they are actually preterm. She went into labor for some reason at like 55 days. So needless to say, unfortunately, they did not make that. But I don't want anybody to have to deal with that because we want those beautiful puppies. Now, why are we ever going to plan a C-section for a dog? Obviously, we know certain breeds, we have to plan a C-section just because they've got these nice little wide shoulders, these teeny tiny little hips. Certain breed predispositions, absolutely. Outside of those, if we have, that lab that has 1 or 2 puppies, may not go into labor. You know what? Her due date is on Monday. I'm going to see you on Tuesday if she hasn't had those puppies by herself, and we're going to go ahead and we're going to plan that C-section. Or flip side of that coin, if they've got more than 10 puppies, if we've got a really giant litter, um, not to say that they can't have them on their own. We've got a phenomenal Dalmatian breeder. Her bitch, she popped out like 15 puppies in 8 hours. That's phenomenal. But then again, we've had some that go every 2 hours in between puppies. And if you've got 12 puppies in there, you're looking at a 24-hour event. She's going to be tired. So things sometimes to consider for them, depending on the shape that the bitch is in and those kinds of things. As I mentioned before, progesterone has to be less than 2. Okay, if it's above a 2, we're not going to C-section yet. The other thing, though, I do like to check on them on my ultrasound. I look at the fetal kidneys, I look for GI motility. I want to make sure that these puppies are ready to come out. I'm also checking the fetal heart rates because we know fetal heart rates are very indicative of their stress levels. So we've got lots of different things that we can look at. So I have had some bitches where their progesterone was still high, but those fetal heart rates were low. And I was like, you know what? We're going to go ahead and we're going to take her to C-section. And so the other question that we get a lot is, if you go to C-section and you have this surgery, puppies do great, mom does great, does she always have to have C-sections? So my rule of thumb is, if they've had 1 C-section, they are allowed to try basically the VBAC, so the vaginal birth after a cesarean. Nothing wrong with that. I'm going to be monitoring them a little bit closer, and I'm also not going to let them go as long with some of my normal call-if parameters. I want to see them a little sooner, just because I do have a weak spot in that uterus that was made. I've done this in my own bitch. We did a C-section on first one because she had a singleton, but she free whelped all of her other litters after that without any issues. After they've had a second C-section, that is usually when I recommend that they have C-sections from here on out. Now, when we're doing a C-section, obviously we're going in there, we're weakening the body wall. These are also the dogs that I am going to limit the number of times that we open that body wall. And so depending on how they look, Some bitches might only get 2 C-sections. I usually try to limit them to 3. Not to say that I haven't taken bitches to a 4th C-section because their body wall is in great shape, their uterus looks great. But even in human medicine, OBGYNs will actually tell you that if you're needing a C-section, they really do try to limit you to 3 as well, just because the body wall wasn't meant to be opened as often as we're opening it. And if we're also doing a surgical insemination and then we're then having to go back in and do a C-section, or again, we're weakening that body wall, which is then going to limit her reproductive potential as well. All right, so what next? What are we going to go with? So you've got your beautiful litter on the ground. We've got all of these puppies. They're doing great. We're happy, healthy. Where are we going to go next? So this is again another kind of one of these heated debates on whether or not you should breed back to back or skip a cycle. There are several breed clubs out there that they make you sign their code of ethics that you are going to skip a cycle in order to be a member of their club. I'm not really sure why that's the rule, but if that's what they say, then that's fine. But the uterus has one job in the body, and that is to maintain puppies and to be pregnant and to help with puppy rearing and all of that. That is the uterus's only function in the body. Without ovaries, the uterus is inert, it just kind of sits there. And so as long as the dog is in good body condition, she's where she needs to be, before her next heat cycle, she's eating well, her hair coat looks good, you have no concerns about where she's at, then I don't have any reason for you to go ahead and breed them back to back to back. Get the litters you want out of them and then get them spayed so we can minimize other issues that we get concerned about, like pyometra and mammary cancers and those kinds of things. That's my take on that. Whether other people have other thoughts on that, that's fine. All right, now switching gears onto our boys. All right, so sperm production. So as we mentioned earlier, that male he had collected beautifully, had a litter on the ground 6 months ago, and all of a sudden now it's bloody. When we're looking at a semen sample that we collected that day, that sperm was actually produced 2 months prior. So we then have to look, what was he doing? Was he in heavy work? Was he out there competing? Was he sick? So what are all the things that we worry about killing sperm? In the grand scheme of things, everything. If they're running a fever, certain medications, blood in the ejaculate, at the end of the day, basically everything can kill sperm. And so we're very cautious about how we handle the semen. When we're looking at the semen, obviously we want it to be that nice, normal, milky color. That red or brownish color can be that blood. Yellow is probably urine. If it's green, please go see your vet. That's a problem. We've got some pus in there. Volume is very variable between the dogs. So we had a Yorkie that we used to call our one drop wonder. That was basically what he gave us, and he got every bitch pregnant. And then we've got some boys who will give us a lot. Now, the caveat to this is when males are ejaculating, they ejaculate in fractions. That first fraction is that clear prostatic fraction that basically cleans out the urethra, getting rid of all of the other debris, neutralizes the pH from the urine to make sure that it's got a safe passage for the semen to come through. Then the semen comes next, so that's our sperm-rich fraction, and then it's going to follow it up again with that prostatic fraction. And so the sperm-rich fraction is actually usually a very low number. It depends on how much prostatic fluid from that third fraction that you actually collect that can then give you a lot. And so you tell me that you collected 25 mils off of your male, you probably collected an excessive amount of prostatic fluid, which is just really going to then end up diluting your sample, and you're going to actually have less sperm per ml. And so honestly, once you're collecting your male and you see that sperm goes from that nice cloudy thick to that almost clear fraction, collect a couple more drops and then you're usually good. You don't need anything else because all of that is just prostatic fluid. It's just kind of a waste. I do collect some prostatic fluid if I'm doing a vaginal insemination, just to give it a little bit more extra volume to kind of get it to where it needs to go, but it doesn't need a ton. All right, when we're looking at our sperm swimming, normal motility, this is forward progressive motility, is about 70%. That's kind of average where we want it to be. Some males are significantly higher than that, and that is great. But if you're less than 70%, maybe we need to talk about what we can do to kind of help bump that up. Morphology is the other piece of that. So morphology is how the sperm is shaped. So all of these sperm with all of these coiled tails, they're not going to be swimming in a nice forward direction like this little guy is here. So I know already when I look at this motility, my motility is going to be significantly lower, but or obviously our morphology is there. Now the problem though with some of these defects, like these little ones up here where we have these little things kind of behind the neck of the sperm, we don't necessarily know what effect those have on fertility. And then that one's just a little further back. Maybe they can fertilize, maybe they can't. But these coiled tails probably aren't going to make it anywhere near the egg. They're going to get stuck someplace else. So if we've got a lot of these looking sperm, you might need a different stud dog. All right, freezing semen. So this is best done while they are younger and in their peak fertility window. Unfortunately, I usually get a tendency to see a lot of older males that all of a sudden now we've seen their prospects and they're great, and now we really want more of him. Um, but now he's either got a really bad, you just got a really bad diagnosis. Oh man, we should have collected semen on him sooner. Let's go ahead and do it now. It's almost a stage of grief. You go through anger, denial. Let's freeze semen, and it may not end up being the way we want it to. Obviously, when we go through the freezing process, it is expensive. It's expensive to store it every year, and it's very expensive to use it. So, if you've got that stud dog that you know what you really want to, keep some of this back for future generations, something we're going to want to go back to because he's got beautiful clearances. He's a wonderful dog. Then, definitely consider freezing him while he's younger, that, 3 to 4 range, instead of waiting until he's about 6 to 7. All right, our prostate. So this is a normal prostate here. For reference here, so tail of the dog would actually, nope, sorry, wrong way. Tail of the dog would be back here, head of the dog is over here. So we've got our prostate that we can go in rectally, we can feel this. So this would be an enlarged prostate. It's pushing up on that colon, which is where we can sometimes see some pencil thin stools with this. The prostate does enlarge with age. It is a different physiologic process than what happens in humans. Even though it does surround the urethra, it doesn't usually affect urination, but sometimes it can. Most common prostate things that we can see are that benign prostatic hyperplasia, prostatitis, and prostatic neoplasia. Prostatic neoplasia doesn't happen that often, thank goodness. It does exist, but just kind of something that we put in the back of our minds, not something I'm going to go into depth today. Benign prostatic hyperplasia. So this is a normal aging change. Testosterone down here at the bottom gets converted to dihydrotestosterone. That's our potent form of it. Basically cause that prostate to enlarge over its lifetime. Okay. What you're going to see sometimes, you might see constipation, pencil thin stools. You might see blood dripping from the penis unassociated with urination. They're just walking around the house just dripping blood. It's probably his prostate before I'm going to blame anything else. You might see some blood in the ejaculate. Those kinds of things can make me concerned about this. Now, extremely sexually stimulated males also can sometimes have some blood in their ejaculate just because the prostate's kind of angry, not necessarily related to this. If he's no longer going to be bred, then castration, of course, is our treatment of choice. However, we do have a medication if we have this male that we need to keep in the breeding program for a little while longer, or you know what, he's been doing good, everything looks great, he's been getting bitches pregnant, we're going to freeze some semen real quick first, and we need to get that sperm back to a normal place before we consider freezing it. That's where we're going to start them on a medication called finasteride. And what finasteride does is it blocks that conversion from that testosterone to the dihydrotestosterone. And what that allows it to do is the testosterone is still there. So we still have all of those secondary sex characteristics that we want, the libido, the drive, all of that making sperm, but that prostate can then shrink over time to make for a more normal dog. So we can get better sperm production. This is not a medication that they are on for the rest of their life. This is basically on for a couple of years until we can go ahead and get them neutered when they're done with their breeding career. Prostatitis, now this is an infection in the prostate gland, usually occurs secondary to that benign prostatic hyperplasia, some other systemic disease, or even neoplasia. It is very rare for our males to have recurrent urinary tract infections just because of the length of your urethra. The females have a very short urethra, they pee very close to the ground, very common for them to have a urinary tract infection, not so much for a male. So if I got an intact male that's coming to me for a possible urinary tract infection, I'm probably going to be looking at his prostate. When we're treating prostatitis, we're very selective in what antibiotics can even get into the prostate. Prostate is considered a privileged site from the immune system, so we have to be careful about that. We need to treat the underlying cause, obviously, but they're going to be on antibiotics for a couple of weeks when we're dealing with this. All right. Paraphimosis or priapism. So basically, for some reason, the penis doesn't go back into the prepuce. You see all those commercials that everybody Googles at. If you have an erection lasting more than 4 hours, please go see a doctor. Yes, please go see a doctor. This is a medical emergency. The canine penis is not meant to be exposed to the air. Whenever I am collecting a male dog here, he has to be back in his sheath before he's ever allowed to walk out of the door, because this dog in the picture here, he basically, was humping on some of the female dogs, got put in his cage, and then unfortunately, this is what happened. Lots of different reasons that this can happen: sexual excitement, inflammation, trauma. Those are the big ones that we can see. But definitely something, make sure that those males are completely put away back in their sheath before they get, put away, and then not looked at for a couple of hours. All right, cryptorchidism. All dogs have two testicles, whether or not it's somewhere in the abdomen versus, actually in the scrotum. There's not anything in the literature that says that we have one testicle in a dog. Dogs are considered cryptorchid if it's not descended by 6 months of age. Now, in my books, if this is a dog that I want to be in my breeding program, it really needs to be down by 12 weeks of age, because delayed descent is a form of cryptorchidism, and we don't want that in our breeding programs. We do know that retained testicles do not produce sperm, but they do continue to produce testosterone. So you're still going to have the secondary sex characteristics if they are retained. The bad thing with retained testicles is they will eventually become neoplastic. This isn't something that's going to happen within the first year of life, but this is something that they're usually a little bit older, somewhere between that 4 to 6 range are the ones we get most concerned about. It is obviously considered hereditary, so we don't want to be breeding dogs that are considered cryptorchid. Bilateral castration is recommended. However, we can just remove the internal testicle and leave that external testicle. But because we know that they're not going to become neoplastic until a little bit later in life, I'm really okay waiting until these dogs are 18 months to 2 years of age before they're neutered anyways. That way we can just go ahead and remove both testicles at the same time. They're done growing, then they just get to go be a regular dog. Testicular neoplasia. The good thing in descended testicles, this is that caveat, this is not a cryptorchid testicle, this is both testicles in the scrotum. Metastasis is uncommon. They come in for their yearly exams, we palpate their testicles, we can feel things that are going on in there, we can neuter them, we get rid of it, we move on with our lives. That's the good thing with dogs and testicular neoplasia. Very simple, get rid of it when it's there. And then testicular degeneration. So this can be a normal aging change. So basically we've got our normal testicle. So definitely if you don't palpate your dog's testicles, you really absolutely, you should. You can feel this band of tissue that sits over it in comparison to the testicle. When it starts to atrophy, that testicle gets significantly smaller, and that epididymis, or that band of tissue that sits over that testicle, is much more prominent and easier to feel. This sometimes can be a normal aging change. I've seen dogs that have gone through heat stroke incidences all of a sudden have some testicular atrophy as well. Once it starts to atrophy and become like this, there isn't anything we can do to make this better. All right, so kind of to wrap everything up, always have a backup plan for everything. Our timing is so important. And then when we're picking our dogs for breeding, try to pick the ones that have good aspects of fertility. They're easy whelpers, they have large litters. Those are the ones you want to keep in your breeding program. I understand that, her sister won a best in show, but her sister needed a C-section every single time. Maybe that's not the one we want to keep in our breeding program. And so we do know that some of these characteristics can actually be heritable, easy whelping and large litters. So those are the ones to keep in your breeding program, even though they may not be everything you want. And definitely, of course, freeze that semen young for these guys. And with that, I will take any questions. Nicole, I think you're on mute.
Oh, okay, there we go. I think I pressed the wrong button and I started annotating your presentation. Oh no. Okay, there we go. Technical difficulties. Thank you for such an amazing presentation. This was so great to kind of continue all of the foundation we laid earlier this month in part one. And I can tell based on the comments we're getting that everyone else really enjoyed it as well. So we have time, I think, for a few questions. So first, someone is wondering, why isn't primary uterine dystocia often seen?
So primary uterine inertia, that's actually a really good question. So primary uterine inertia causing a dystocia, because most of the time we're not, so dogs, again, different from every other species. In our horses, we have the fetus has to roll around in the uterus so many times in a certain day period. So the uterus tells the mom, hey, I'm pregnant, don't abort me. Dogs don't have like the maternal recognition of pregnancy, and they're pregnant basically for that time. We think it's the puppies getting stressed because they're outgrowing their placenta, they're outgrowing the size of the uterus, they're kind of cramped in there. There's a lot of them in there. And they start raising their cortisol levels, which then goes and tells mom, hey, it's time to kick us out. We believe that's the presence of why they are supposed to go into labor. But we do know I've seen it in a couple of breeds, and I do wonder, could there be a heritability component to it? So if we see it in a dog, then we don't want to continue that line. I don't have a good answer as to why we don't see it, but I think because more of it is puppy driven, and if you've got a large litter, it's going to tell mom, hey, we need to do something, we need to get going with everything we need to do.
Awesome. That was super helpful. This next question is kind of related to that. Someone is curious why puppies that are born more than 2 days early have a lower survival rate.
So with so that comment is, so puppies born more than 2 days early is more from a perspective of, we don't have progesterone timing and you're asking me to cut your bitch at a certain period in time. Now, if I have a timed bitch and she's got a really large litter, so we've got, 18, 19 puppies, something big in there, I expect them sometimes, we might go 2 days early. But that again goes back to that puppy stress. And they know that, hey, stress also helps them develop a little faster, to make them be ready to come out sooner. And so all of that plays together. But if we don't have the timing to know exactly when that bitch is due and we just go into C-section, because basically, so dogs are pregnant for 63 days, which is 9 weeks. Humans are pregnant 9 months. And so I'm taking everything that happens. So then being in that uterus for another 6 to 12 hours is actually going to add on additional maturation at a much faster rate, than them being in there for, like another week or so. So as long as we can keep them in there, we're going to help them to develop a little bit faster.
Got it. Thank you for going over that one. Another one, I think this might actually be left over from the presentation earlier this month. Can you speak to the coefficient of inbreeding and how one should utilize that information in their program?
Right. So inbreeding coefficient, I don't actually think I touched on that, but when we're looking at our inbreeding coefficient, and you look at the data, kind of across the breeds, most purebred dogs sit at an inbreeding coefficient of about 20%. Now, when you're calculating your inbreeding coefficient, there's a couple of different ways to do it. You can do your pedigree analysis. How many people do we have related? Assuming that we've got 50% from each parent coming through, and that's going to give us our coefficient there. You can also do it genetically, which, a lot of our genetic tests with, Embark and Wisdom Panel have allowed us to figure out what it is, because maybe we actually got 70% of our genetics from this line instead of the 50%. And so that gives us might be a vastly different, inbreeding coefficient. The lower the number, the better. Obviously, that's the way what we're going for. However, we know, certain breeds, like our otter hounds, we've got less of them out there. We want to preserve the breed as best as possible, so their inbreeding coefficient is going to be a little bit higher. But when we've got dogs like our Labrador retrievers that are so common, there's really no reason that we can't go ahead and pick a different male or female, honestly, to use for a particular breeding, so we can make sure we get that lower inbreeding coefficient, so we can make sure that the puppies we're breeding are going to be better. Because the closer we are with our genetics, we always say we double up on the good, double up on the bad. I heard a term a couple of years ago that I like a little bit better. Yes, we double up on the good, but instead of doubling up on the bad, we're actually potentially unmasking some bad things. So there might be some things hidden in the genetics that we didn't know existed in our line, and we get too close to that, and all of a sudden we've got new problems that never existed where they weren't before because we kept that inbreeding coefficient a lot lower. So that's kind of the big part to making sure that we can do what we can, prevent those
Yeah.
genetic bottlenecks, and keep our population diverse.
That's really interesting. I had never heard that perspective before, that you can kind of unmask more than you would
Mhm.
realize, which is pretty interesting. I think we have time for one more question. This is coming in from Sherry, who's wondering, if we're breeding back to back, at what age do we retire our females? She said new breeder that comes from one, I believe, breeding a year and retiring by 6.
So, when we're looking at our breeding ages, obviously I like them to be at least 18 months, before they have their first litter, because that way they're skeletally mature, they're mentally mature, they're ready for this. And it really kind of depends on how often that they cycle. So shepherds have a tendency to cycle more frequently, whereas our Basenjis can be every 18 months, sometimes between cycles. And so when you're breeding back to back with those breeds, you're in a different perspective. And so I don't necessarily put a cap on how many litters they can have as long
Mhm.
as they're in good body condition. And, when I start to see, litter sizes dropping, so she's consistently had 8 puppies, 8 puppies, 8 puppies, and all of a sudden I've got 3, maybe we're done. Maybe she's getting tired, she's getting old, things aren't the way they're supposed to. When it comes to an actual chronological age, I have a hard stop at 8. That is my personal moral, ethical compass where I stop there. I do require blood work after a bitch is 7 years of age, because I want to make sure that they're still healthy and I'm not missing anything else bigger picture before we consider going forward with the breeding process. So there's not necessarily a magical number, but if you like her, and again, we don't want to oversaturate the market with this particular dog's genetics, keeping our population diverse. Maybe we're only going to do 3 or 4 breedings with them and then get them spayed. And if that means that, she's done by the time she's 5, then she's done by the time she's 5, or maybe even sooner, depending
Mhm.
on, we see the first litter of puppies, maybe she's not really what we want to continue with.
Right. So there's not like a hard and fast number. It's more
Right.
like
It
all of
it
those
depends. It
different
depends on the
factors.
bitch.
Right.
She runs the show. We're just along for the ride.
Yeah. I love that. I feel like that applies to life.
Absolutely.
Amazing. I think that was our last question. Thank you so much again
Right.
for being here, Dr. Barstow. This was such an amazing presentation.
Uh-huh.
And we're
Perfect.
just
No,
so
thank you
excited
guys so much for
to,
having me.
of course, you're so excited to welcome you back. And I did want to point out, this is the only question I'm qualified to answer. This was
Okay.
all recorded. I saw someone ask that, or they mentioned they joined late. So you can watch this right from the beginning as soon as we end the live, which will be in just a few seconds. So just wanted to remind everyone of that. And sadly, this is the end of our health symposium. Like I said at the beginning of this session, thank you all for being here for all of these sessions, for being such an incredible audience, asking amazing questions. And we are so excited to just continue hosting events like this. So while this is the end of our 4th annual health symposium, we have many more learning opportunities coming up for the rest of this year and into next. So please continue sharing with us what you want to see us cover next. I will share a little bit of a preview of what's coming up next. So this is not the end of health content for the year at Good Dog. We do have something else coming up in November, so everyone gets a little bit of a break for the rest of October. But our next presentation is going to be with Dr. Cheryl Lopate, and it's going to be managing your brood female from birth to retirement. And that's going to be on November 6th at 5 p.m. Eastern. So everyone here gets a little bit of a sneak peek. We'll announce that in a few weeks, so you have plenty of time to register. But I just wanted to reiterate to everyone that these opportunities to learn are not going away, even though our symposium is sadly ending. And one more reminder before I close this live, since our symposium's ending, please make sure that you take that last follow-up quiz with everything you learned from today's session, so you can be eligible to win those exciting prizes that I mentioned earlier. And then keep an eye on this Facebook page. Later tonight, we're going to be sharing an exclusive attendee badge that you can share to your personal page and tell everyone that you attended this symposium and share what you learned, so we can continue sharing great information about canine health among dog breeders. So that's it from me. Thank you again, Dr. Barstow. Thank you again to our audience, and we're looking forward to seeing everyone at our next webinar. Bye, everyone. Thank you so much.